So when you look at the endocannabinoid system, it's a lock and key. It's a little bit more complex than that because the keys vary. There could be your endogenous endocannabinoids, they could be your plant-based cannabinoids, they could be your synthetic cannabinoids. They all work on the same downstream receptors, CB1 and CB2. Those receptors then in turn control a whole host of physiologic functions. And it is not as easy as you take one compound, you feel this way. What's very unique is there's something called agonist trafficking. That means that whatever binds to those receptors elicits a different door it opens. So the receptor works differently based on what is binding to it. And there are a plethora of these receptors in our brain, and there is a significant amount of them in our central pain areas, our dorsal horns of our spinal cord, which transmit pain, as well as in our tissue and our organs. Next slide. So here's the CB1 and CB2 receptor. CB1 mainly in the brain, all throughout the brain. There are actually more CB1 receptors by density than even dopamine receptors in our brain. So these receptors control a whole host of function, and a lot of them are concentrated in the hippocampus and the amygdala, which I'll show you next, where learned anxiety is done, where there's patterned fears for PTSD is set, and there was a whole host of serotonin receptors in that same area of the brain where the CB1 receptors are. CB2 receptors, peripheral immune system and immune cells, and some of our peripheral nerves. Next slide. So here's a picture of the brain. CB1 receptors are throughout the brain. Two things to understand from this. That area where they say hippocampus, and there is an area in there called the amygdala, that is where you get a lot of your PTSD, your fears, your learned anxiety. That is where you begin to see why CBD affects mood and anxiety so well, because it affects the serotonin receptors in that specific area of the brain. And not only does it do that, it does a whole host of other things like increasing your endogenous anandamide. It potentiates a serotonin receptor. It works on another set of receptors called the GABA receptor, which is inhibitory and helps you sleep. And we'll go through some of this, but the gist of this is there is not many of these receptors on the brainstem. So the idea that you would overdose from a cannabis-based product is not there. You cannot overdose, unlike opiates, which we have used in a huge volume over the last 20 years. And this has been something that has hit us like an epidemic. And there are over 46 to 50,000 deaths a year from these opiates. And we are now trying to reel all this back because the rest of the world does not utilize opiates like we do here in the US. Same thing with benzodiazepines, which we are using for anxiety. That is all we got for anxiety, and you need a higher and higher dose of it. And it is addicting, and if you cross-react it with alcohol and opiates, it can shut your respiratory drive down. Those are the agents that should be only used for the patients who really need it. Everybody else coming through our door has probably mild anxiety, and we are giving them extremely strong medications with significant side effects without counseling and without having an alternative, such as a plant-based anxiolytic like CBD, which has very little addiction or overdose potential. So next slide. So, this chart kind of gives you an idea of how the different cannabinoids are, and they're in much smaller volume, but as you begin to extract them through technology that we have, from gas chromatography to various extraction techniques, which the biopharmaceutical industry will come into, you begin to see they each have different properties. And when you look at the cannabis plant as a whole and the strain that it produces, that cannabis plant, it has a whole mix of these cannabinoids that all work in harmony together. What we have begun to understand is we are also giving products where you have extracted just CBD. You don't have the other cannabinoids, but the other cannabinoids have varying properties. And as the science progresses in this in the next few years, pharmaceutical industries, equipment and technology comes in, you will begin to see these other isolated cannabinoids used for certain medical conditions. There are even some THC derivatives that lead to weight loss, not weight gain. So you can begin to see how complex this plant is. And as we start to get more and more information, we will be able to integrate this into well thought out clinical trials as this is more deregulated. But this kind of gives you an idea of the amount of cannabinoids there are, and this is only a small portion of them. There's lots of other ones in small varying degrees in the cannabis plant. Next slide. So again, the receptors mainly in the brain, and that's the reason why we get sleep benefit. That's the reason why we're getting anxiety benefit, stress relief. You will begin to see a lot of pain disorders that have a neurologic or a psychiatric component, such as fibromyalgia, irritable bowel syndrome, the spasticity. You treat their anxiety and centrally their pain gets a lot better than someone who just has an inflammatory pain component, because CBD has an anxiolytic component. And by relieving anxiety, you can affect people's pain in a positive way as well.